Hello everyone, welcome to Macleods Medlive Expert Opinion Indian Perspective. We are at the RSSDI Conference 2019 conducted at the JECC, Jaipur, Rajasthan. I am your host, Dr. Sanket Nevale, representing Macleods Medical Affairs. Today we have with us Dr. Unnikrishnan, who is from Pune, and he is an eminent endocrinologist. He has delivered a session on resurgence of an SU wave, lessons we learned so far. Sir, I humbly request you to summarize your session for the benefit of the fraternity. Sir.
Yes, thank you so much. It's a pleasure to be here firstly, and I'd like to begin by saying that whatever I talk is mainly for the medical fraternity, and if you are not a healthcare provider, you must meet your doctor before making decisions on any part of your treatment. Well, my lecture today to the doctors was about sulfonylurea, which is a group of drugs which have been available for the management of diabetes for so many years. You know, the basic cornerstone of diabetes management is diet and exercise. And after exercise comes medicines. Some medicines, like for example metformin, the commonest medicine used in diabetes, can bring down the blood glucose levels without causing them to be dangerously low, what we call hypoglycemia. But some medicines like sulfonylureas have been around for decades, but they have a problem that if the blood sugar is high, they may not just bring it to normal, they may also cause hypoglycemia. For years it was believed that this hypoglycemia increased the risk of cardiovascular events. But recently there was a study of this old group of drugs called sulfonylureas, which are relatively common and inexpensive medicines used in India, pitted against the newer agents which are much more expensive. And to the surprise of the scientists and the researchers, they found that while this sulfonylurea group of drugs increased the chances of hypoglycemia, this group of drugs did not increase the risk of cardiovascular events. In other words, sulfonylureas are safer than the medical fraternity thought they would be. At the same time, doctors and patients have to be aware that sulfonylureas can cause hypoglycemia, so patients need to be told to eat regularly and check their sugars when they are in SUs. But some interesting questions that come about are that whenever a new medicine comes, there is a tendency for all of us, the medical community, that we somehow think that because the new medicine has come, the old medicine may not be that good as we thought before, which is true because any new medicine is an innovation over the older medicines. But sometimes surprising research comes to light and shows us that the older medicines are actually, as I say, old is gold. They are actually gems because they are inexpensive, and also they have been around for years and we have years of experience, and some of them aren't as unsafe as we thought they were.
That's wonderful, sir. Sir, I also would like, I'm sure you would be referring to the trial called as the Carolina trial, which was glimepiride as an SU versus linagliptin as a DPP-4 inhibitor. And so in that trial, it was shown that glimepiride, which didn't had any CVOT kind of a background trial or a dedicated trial, because it was before 2008. So it gave an importance to this molecule in the class of sulfonylurea that now it can be used in cardiac safety. Even though it has chances of hypoglycemia, it didn't reciprocate to cardiovascular outcomes or bad cardiovascular outcomes. So do you see that this molecule, glimepiride, might have a good future in the coming years now?
Well, it's always important to be aware that sulfonylureas can have one major problem, that is hypoglycemia. But if you look at the vast majority of people with diabetes, the problem isn't hypoglycemia, the problem is hyperglycemia. Most of the blood glucose levels are high, and that means that we have to reinforce diet and exercise and an appropriate medication. Now, if you look at sulfonylureas, the good thing about the new research was that sulfonylureas were found to be as cardiovascular neutral as the non-sulfonylurea newer medicines. Like, for example, you alluded to the medicines in the Carolina study. Right. The problem was that it increased the risk of hypoglycemia. So the advice to patients should be that when they are on sulfonylureas, they must eat on time. I suppose everybody should eat on time, not just people with diabetes, even people without diabetes should eat on time, but they should eat on time if they are on sulfonylurea, otherwise they may get a low sugar. And also, they must find some time to snack in between a healthy snack. It's not easy to do a healthy snack because what is a healthy snack? Is it a small handful of nuts? And can somebody stop with a handful of nuts if they've had that? So there are a lot of challenges out there in the daily lives of people with diabetes. But at the same time, if one can follow a healthy meal pattern and have a healthy snack in between, then you minimize the chance of sulfonylurea-induced hypoglycemia. Is it better, therefore, to manage diabetes with agents without hypoglycemia? I guess so. It's better to manage diabetes without medicines that can produce low sugars. And what is the best medicine for that? It's diet and exercise. It's not a medicine, but it is a medicine, and it can help us reinforce diabetes control.
Wonderfully said, sir. Diet and exercise, lifestyle modification, being on the prime at the top. And I'm sure with this, there would be a lot of guidance that would reach the patients through the doctors and the fraternity, and with turning out into diabetes with better outcomes. Thank you, sir. Thank you for the excellent session today.
Thank you for the opportunity to be here. It's a pleasure to be here. Thank you.